Thank you so much for that lovely introduction. It is truly a delight for me to be here. I'm usually one of those sitting in the booths in the back, so it's quite something to be the person in front for once, the person that's being interpreted. So thank you so much for giving me the opportunity to talk about my research. Today I would like to talk about interpreting in mental health care settings, mental strains and self-care for interpreters. So, first of all, why did I choose this topic and why is it so important? So as Jenny mentioned, I wrote my thesis on interpreting in mental health care settings this spring with a special focus on interpreting for traumatized refugee children. Why is this so important? I think we all know why it is incredibly important. The number of refugees and asylum seekers worldwide has skyrocketed in recent years, with 82.4 million refugees worldwide. And keep in mind, I wrote my thesis before the war in Ukraine broke out. So, all refugees, no matter where they originally emigrated from, share a range of challenges and difficulties, including, for example, pre-settlement experiences. I totally forgot one thing. I would like to utter a trigger warning. I will be mentioning different mental illnesses such as anxiety and depression. I will also talk about traumatic experiences such as murder, persecution or rape. So if you are triggered by these things, this might not be the talk for you. But let's dive right in. I mentioned pre-settlement experiences, such as witnessing the murder of a family member or a close friend, for example, persecution, torture, grief, sexual or physical assault, and separation from loved ones. But once they have fled their countries, they have to overcome more obstacles, the so-called post-settlement experiences. Here we're talking about discrimination on site in the new country or loss of support. What's the result here? Many refugees experience increased psychological distress. We can see, for example, symptoms of PTSD, so post-traumatic stress disorder, but also depression, psychotic illnesses, and anxiety. What can you do when you suffer from one of those things? Of course, you seek professional help and you talk to a professional, so you do a therapy. Having access to therapy to discuss this mental distress can benefit the refugees and, of course, their mental health. However, here we have a problem. In most cases, the HCP, so the healthcare provider, and the patients do not share a common language. This is a massive problem, because in order to provide high-quality mental health care services, you need to understand your patient. You need to form a connection with your patient. I will touch upon this later. This is called a therapeutic alliance. And this is difficult enough when you share a language. Of course, therapy isn't easy. Sometimes it's hard to open up at first. It's hard to connect to a person. And of course, this is exacerbated if you do not share a common language. So what can you do? You can hire an interpreter. A well-trained mental health care interpreter can help overcome this language barrier between the HCP and the patient. So as we can see, interpreters are crucial here, and their role is quite complex, but they are largely neglected in published literature, especially community interpreters. Another thing that is largely neglected in literature is interpreting in mental health care settings, how this can affect the interpreter, and also self-care for interpreters. It is gaining momentum now, but I think there's still a lot to do, and I think that's an utter shame. Right, this is why I wanted to focus on this topic within the scope of my thesis, because first of all, it's very interesting in my opinion, but it's also very important. I wanted to explore negative as well as positive impacts of interpreting mental health care settings. I wanted to look at self-care measures that you can adopt as an interpreter, and I wanted to focus on the benefits of post-setting counselling or therapy for interpreters after the encounter. I wanted to take on an interdisciplinary approach, so intertwining psychology, educational science, communication science, and of course, interpreting science. I think it would benefit us to take a look at my research questions beforehand. So I had 6 in total. First, what are concrete aspects that cause mental strain in interpreters? Second, what mental strains result from interpreting in mental health care settings? Third, what positive impacts result from interpreting in mental health care settings? Then, how can interpreters combat possible mental strains? Fifth, which role do post-setting counselling sessions play in combating mental strains? And lastly, what are possible dangers of not adopting self-care measures? Right, what is our agenda for today? What will I be talking about? First, I would like to touch upon interpreting in mental health care settings and what it entails. Then I would like to take a closer look at mental strains that can result from interpreting in mental health care settings. Then we will take a look at post-setting self-care or self-care in general that interpreters or anyone really can adopt. Then I will touch upon my research and my findings, and lastly I would like to draw a conclusion and just give you a wee outlook. Right, let's first talk about interpreting in mental health care settings. In mental health care settings, the demonstration of symptoms, talking about a diagnosis, talking about the therapy in itself, and talking about recovery all occur via communicative interactions. So it's very important to gain the trust and the confidence of the patient through communication. As I said, in most cases when treating a refugee, you don't really share a common language with your patient. This is why we need interpreters. They really do play a key role here, because otherwise you just couldn't have a therapy session. Here, mental health care interpreters are confronted with multiple layers of culture, different rules, different regulations, and they need to familiarize themselves with all of that to provide adequate services. And I mean, this is our main goal as interpreters, whether you work in conferences or whether you work in healthcare or mental health care settings, you always want to provide adequate service, right? So, what will we look at within the scope of interpreting mental health care settings? First, we will talk about the participants, so who partakes in those therapy sessions. Then, as I said, we will talk about the therapeutic alliance and how you can form one with your patient. Then we will talk about the role of the interpreter or different approaches to the role of interpreters. Then I will touch upon guidelines. And lastly, I will just give you a few details on how interpreting for refugees differs from other mental health care encounters. Right. Here you can see the 3 participants of interpreter-mediated mental health care encounters. We have the HCP, a healthcare provider or therapist. We have the patient, and we have the interpreter. And I chose to align this little graph like this because you have the healthcare provider on the one side and the patient on the other side, and you have the interpreter in between that tries to mediate between the 2 parties. So, the HCP, of course, is crucial to our encounters. They have technical knowledge, they have expertise, and they play a key role in helping their patients. Then you have the patient who seeks assistance or a service or just wants help because they suffer from mental illnesses. Then in the middle, you have the interpreter, and as I said, as soon as you have 2 parties who do not share a common language, you need someone to mediate between the 2 of them. So it is important to mention that interpreting in this setting doesn't only encompass the communication of spoken messages, no, it's also paralinguistic features such as body language or facial expressions, gestures or intonations. All of this can play into diagnose your patient. Next, we have the therapeutic alliance. I would like to quickly define what therapeutic alliance means. So it's being said that the doctor and the patient are partners, so to say, and they are engaged in a common struggle against an illness, so they work hand in hand together. In order to combat this illness, you need effective and empathetic communication to establish trust between the two parties. This is one of the core pillars in the provider-patient relationship. And often when interpreting for refugees, you have differences in race, ethnicity, and language. All of this can impact this relationship between provider and patient. Due to insufficient exchange of information, the refugees, or just patients in general, may not feel comfortable to participate in medical decision-making. Or let's say they do agree to do therapy, but they struggle opening up to their HCP and they don't really feel comfortable. So for all extents and purposes, it can be stated that communication between provider and patient is often problematic, even if they do share a language. But when you add an interpreter to the mix, or a third party in general, this can add yet another layer of complexity. Therefore, you want to ensure that the interpreter improves the communication between the two parties instead of hindering it. Because if used improperly, interpreter-mediated communication may even prevent the two parties from establishing a therapeutic alliance. Right. Let's now talk about the interpreter's role or different approaches. When talking about the interpreter's role, there are two different approaches that you take into consideration. You have the direct versus the mediated approach, also referred to as the visible versus the invisible, or the involved versus the uninvolved approach. Let's first talk about the invisible approach, or also called uninvolved or direct. This is a directly interpreted interaction. The two parties address each other directly through the interpreter, and the interpreter then interprets every turn. By doing so, the responsibility for directing the consultations always stays in the doctor's hands, and the patient can decide independently what to say and how to say it and how to express themselves. Therefore, the primary parties, so the doctor and the patient, are responsible for effective communication despite the presence of the interpreter. Let's take a look at the other side, so the visible or uninvolved or mediated approach. Here, in this mediated interaction, two conversations take place. One between the doctor on the one hand and the interpreter on the other hand. In the mediated approach, the interpreter sort of acts like a gatekeeper who decides which parts of the speaker's utterance will be transmitted and whether to add additional information. Great. Moving on to guidelines. So there aren't really guidelines interpreters or therapists have to adhere to. Those are just sort of suggestions, and I think every therapist or every interpreter handles it their way. But those are just some basic guidelines that can help facilitate your job as an interpreter. Here we distinguish between pre-encounter, during the encounter, and post-encounter. First, we have pre-encounter. Firstly, as the interpreter, you should just gather information about the interpreting assignment. That's what you do with conference interpreting as well. You just want to familiarize yourself with the client, with the institution, with what they may talk about. So you gather information about the HCP, about the institution, about the sort of encounter you will interpret. Secondly, the HCP should brief the interpreter. Here we have our first problem. That's not always the case. Sometimes with interpreting mental health care settings or community interpreting in general, people are just assigned. You go to your interpreting gig and you're just supposed to interpret. But this poses a problem because we don't know enough about the HCP, how they communicate. We also don't know enough about mental health care settings in general. So not just interpreting in mental health care settings, but also what usually happens during those encounters. By briefing your interpreter, you can help the interpreter to anticipate the way the doctor will communicate or will approach the patient, and they can also touch upon the language that's being used. So, for example, different illnesses or just in general how HCPs usually talk to their patients. HCP and interpreters should also outline the role of the interpreter within the scope of the encounter. I touched upon that earlier. You can either use the direct approach, indirect approach. Some therapists prefer to have you interpret in the first person. Others would rather have you interpret the third person, and so on. Mental health care interpreters are also exposed to a wide variety of registers and technical terms, not just during the encounter, but also during the briefing and the debriefing. So you should know the most common technical terms, such as bulimia, anxiety, anorexia, bipolar disorder, panic attacks, PTSD, OCD, depression, and there are so much more. So just because it's community interpreting doesn't mean it's less difficult, because it's still a very technical topic which you have to familiarize yourself with. Moving on to the encounter itself. First of all, you need to introduce yourself. This can either happen by the doctor introducing you or you introducing yourself to the patient. You can also then ask the patient questions, because of course you briefed with the doctor, but you didn't really have a chance to brief with the client. You can ask them different questions, such as, have you ever been interpreted before? Do you want me to interpret you in the first person, third person? Do you want me to do it consecutive or simultaneous? You have to explain what that means, of course, because I feel like most people don't. A struggle we all know when you are at a party and people ask you what you do, and then you go into a rant on how you consecutively interpret and so on. Secondly, you want to make sure that the patient is comfortable. And I think you can focus on vocab all you want, but that's the main issue. Make sure the patient is comfortable. As I said, the doctor doesn't just rely on the spoken word. We talk about body language, facial expressions, but also things like intonation, flow, repetition of forms, maybe also conspicuous avoidance of different forms, overuse of constructions. So all of those things we usually don't focus on are incredibly important for the doctor in order to diagnose the patient. So we have to transmit that as well. You really do become the patient when interpreting for your patient. Right, so our encounter is over. We have interpreted sufficiently. Now we are in the post-encounter phase. After the therapy encounter itself, the interpreter and the HCP should debrief. What does that mean? In general, it means discussing the emotional content of the session. You can also talk about your emotional state, if that's necessary. I will talk about this in more detail later. So it's not just about, okay, how did this go? How did you feel interpreting that? Were there things you could have done better? Or maybe I didn't know this word or this word. No, it's also about how does the interpreter feel emotionally. Okay, now on to interpreting for refugees, because this adds a lot of not problems, but it adds another layer to our problematic here. As I said, many refugees experience a lot of psychological distress. They can experience PTSD, depression, anxiety, and so on. This means they have to undergo therapy to try and combat their mental distress. In most cases with refugees, the HCP and the patient do not share a language because, let's be honest, we all learn English or French or Spanish at school, but if you have a patient who speaks Farsi, I think most therapists won't be fluent in that language, so you definitely need an interpreter. Another issue that arises here, most interpreters that you hire to interpret for you are probably refugees themselves, or not refugees, but their families have emigrated, and you know about the trauma of fleeing a country, and you know about the culture of the patient. So in most cases, interpreters and patients share a cultural background. Of course, this is very beneficial when you look at it from a more positive point of view, because it helps to build a bond of trust, and the patient can relate to you more easily. But it also causes a lot of problems, because, as I said, the interpreters are familiar with the culture, they are familiar with fleeing a country. If it hadn't been them, it might have been their parents who had to flee a country. So they know, they can relate, and it might evoke negative emotions in them because they know exactly what this person is going through, and it reminds them a bit too much of what they went through or what loved ones went through. This can also trigger them thinking about emotions they had buried in the past a very long time ago. So all in all, or long story short, it's just very emotional for the interpreter. This can lead to over-identification, and it can lead to re-traumatizing. This, in effect, can lead to vicarious trauma, and what vicarious trauma exactly means, I will explain to you later. So, mental strains of interpreting in mental health care settings. Interpreting mental health care settings is exhausting in itself, but when you interpret for refugees, it gets very traumatic and very emotional very fast. It can affect the mental health of interpreters quite heavily, especially when you share a cultural background with the patient, and as I said, that's the case mostly. This can traumatize the interpreter as well, because when you interpret for someone, you become the person, especially when you interpret in the first person. So you feel all of their emotions, because in order to deliver a good interpretation, you become the patient, or you become the speaker. At least that's what we're being told at university, become the speaker. So you really feel what they feel, and you talk about it in such an emotional way because you want to convey the emotion, you want to convey the facial expression, and you want to convey exactly how they feel. So you make yourself feel their emotions as well. Right, I mentioned vicarious trauma. This is the phenomenon of being traumatized by someone else's depiction of their trauma. So you weren't the person that had to go through it, but you heard about it in such a precise manner that it almost feels like you went through that as well. VT is very widespread within the mental health care sector. In general, it mostly affects therapists, but also doctors, and it's also widely spread among firefighters, which I found very interesting as well. And as I said, interpreting mental health care settings or conducting research in that matter is gaining momentum now. So a few surveys have suggested that interpreters interpreting in those settings might suffer from VT as well. Not a lot of research has been conducted yet, which I still think is a shame, but in a good way. So here I would like to talk about vicarious trauma in more detail, what exactly is vicarious trauma, and then also look at how interpreters experience this sort of trauma. Right. As I said, vicarious trauma can be defined as the effect on a person working with survivors of traumatic life events. Of course, we're not just talking about refugees. There are so many different ways a person can be traumatized, for example, when still mental health care related, but you interpret for a victim of rape and the person goes into a lot of detail and it feels like you were there and you feel the trauma the person is still suffering from and it affects you as well. VT is very closely linked to post-traumatic stress disorder, which most patients suffer from, and it has a lot of similar symptoms as PTSD, but it is not PTSD because, of course, you weren't the person that was traumatized by a specific event because, of course, you weren't there. But just to clarify what PTSD is, I'm sure we've all heard about it, but just a few symptoms of PTSD or how a person suffering from PTSD might feel. You experience PTSD after a traumatic event, such as, for example, threatened death or actual or threatened injuries, or you witness an event that involves the death or the injury of another person, a loved one. So that's why people suffer from PTSD. This is how PTSD is triggered. As I said, PTSD doesn't just affect the direct victims, it affects therapists, it affects interpreters, it even affects the people in the close surroundings of the patient, so if, for example, husbands or wives or family members, because you are exposed to the trauma of the person and it affects you too because they talk about it in such an explicit manner, or you feel their emotions because you're so closely linked to them that you just have this close connection that makes you feel what the person feels. So you are affected by this as well. Exactly. As I said, especially in professions where the professional comes into close contact and interacts with the patient empathetically, VT is quite common. Why is that so? While doing so, professionals often absorb information about the suffering. This can absorb to them absorbing the suffering itself. I mentioned a few examples such as torture or abuse or rape or other violent events. And if you hear about this too much and in too much explicit detail, this can really change your beliefs about yourself, about the world, maybe about your faith if you're religious. And for therapists, this can also change their psychological functioning. What are the symptoms of VT? So I said it's quite similar to PTSD, so a lot of symptoms someone suffering from PTSD will also occur in a person suffering from VT. It's quite a long list, I won't mention all of them, but for example, nightmares, insomnia, changes in relationships to family or friends, increased alcohol or drug abuse, intrusive thoughts about the event itself, sadness, general anxiety, depression, the list goes on. But on a brighter note, working with trauma survivors does not necessarily solely have negative impacts on the professional. It can also lead to positive experiences, also known as post-traumatic growth, which I will mention in a bit, because when I conducted my research, it was very evident that most interpreters interpreting in mental health care settings feel a lot of, or experience a lot of positive experiences. And I'm spoilering you here, so I'll just stop and continue. Exactly. A few positive impacts you might experience are the appreciation for your own good fortune or a heightened sense of optimism and empathy. Sorry. Moving on to vicarious trauma in interpreters. So in itself, it's quite similar to vicarious trauma in therapists or, for example, firefighters. But I found it very interesting that interpreters suffer from that as well, because, as I said, it's mostly known to occur in the mental health care sectors, with doctors, with therapists, etc. So how do interpreters play into this? It has become evident that a lot of interpreters interpreting in mental health care settings, or also in war or crisis zones, suffer from mental illness, or VT. And a few studies were conducted, and a lot of the interpreters reported identifying with the pain of their clients and sensing their grief, as I mentioned. They also reported feeling helpless when it came to removing the client's pain, because I think most interpreters, especially the ones interpreting in mental health care settings, are quite altruistic people. So they have this urge to help their patients because, of course, they are not the therapists, but they are also part of this combat against the illness, and they want to help the patient. So seeing that it's not working can lead to a sense of helplessness and also lead to them feeling inadequate and guilty. Especially when interpreting for refugees, VT is a common diagnosis. Interpreters working in those settings are highly prone to be impacted by the traumatic nature of the interpreting assignment. They sometimes experience direct trauma or vicarious trauma, and it is often very difficult for them to let go after the encounter, because as a therapist, it is your main job, but as the interpreter, you go home and that was a one-time gig. The next morning you go to a conference or you interpret at court and you never hear about this person again. You don't know how the patient feels, whether the session has helped, whether the person has to undergo further therapy. So you bond with this person to such a high extent for a short period of time, and then you leave them, and you probably never hear about them as well, because the therapist won't call you and tell you, oh, by the way, our patient is doing amazingly. That's not happening, and it's very difficult to let that go, to accept that, and to just sort of cut this person out of your life. After distressing assignments, interpreters often experience symptoms of secondary traumatic stress, VT. They also experience burnout. They experience different symptoms such as anxiety, insomnia, vigilance, jumpiness. They have low energy levels. They experience nightmares, and again, the list goes on. I don't want to just ramble on. But just to give you a picture, it can get very bad. But again, on a brighter note, interpreters also experience positive trauma growth, PTG. Right, that was quite glim and very dark and gloomy to talk about how you can be negatively affected. And I don't want to, because I don't know who of you might want to work as an interpreter in mental health care settings. It wouldn't be for me, I'm too sensitive to do that, but I'm sure a lot of you have looked into it, and I will talk about how it can be very rewarding in a second. So I don't want to ruin this for you. So if you want to go into interpreting mental health care settings, that was just the bad side of it. We're moving on to the good side of it in a bit. So you don't necessarily have to suffer from VT, because you can prevent VT from occurring and you can combat mental strain. As I mentioned, it can be quite traumatizing, but you can tackle this. Of course, prevention is key, so starting after the encounter might not be the best idea. You can also adopt certain measures before interpreting in mental health care settings. For example, you can attend deep breathings, you can keep a manageable workload, you can undergo targeted training, and so on. When talking about how to combat vicarious trauma, we mostly talk about self-care, and I know self-care has a weird connotation nowadays. When we hear self-care, it's mostly, okay, I'm lighting a candle and I'm taking a bath, but it's actually very serious, and I think this connotation isn't doing self-care justice. So I want to talk about the more scientific side of self-care. Exactly. I will also talk about post-setting counselling, because in my opinion that is a sort of self-care, or at least a measure you can adopt in order to combat any sort of mental strain. Exactly. I hope... Oh yeah, that looks good. Cool. Great. Apart from post-encounter debriefings and counselling, there are a few conventional ways to deal with work-related stress. Again, this doesn't just apply to interpreters in mental health care settings or interpreters in general. I feel like a lot of jobs nowadays are quite stressful because our world is moving so fastly and it's hard to keep up, and you feel overwhelmed very easily. I think we can all relate to that. And those self-care measures are for everyone, really. Of course, we've all heard about the most conventional self-care measures, like listening to music and physical exercise such as yoga or meditation. And that might seem trivial to you, but it really can help you to keep your stress in check and to not let it get so bad that your mental health really suffers from it. And I actually wanted to do a mindfulness exercise as well, but I know the speaker before me did one too. But I thought we could still do it because hers was in German, so we're just going to do it in English this time. So I also would like for you to close your eyes, please. And I don't know how many of you are familiar with mindfulness exercises, but with mindfulness exercises you try to focus on your body and to ground yourself. So what we will do now is I will mention different body parts, and then I want you to focus on those body parts, and I want you to breathe. So you breathe in, hold your breath, and then breathe out. Okay, is everyone ready? And by the way, the people who are joining us via Zoom can also do that at home. Okay, close your eyes. I want you to take a deep breath in, hold it, and breathe out. Now I want you to focus on your forehead. How do you feel in this moment? Next, we move on to our eyes. Do they feel heavy? Do you feel relaxed? Moving on to our mouth. Relax the corners of your mouth. Now unclench your jaw. I want you to take another deep breath in, hold it, and breathe out. Moving on to our neck and our shoulders. Are they tense? If they are, relax them. Let's now focus on our heartbeat. Listen to your own heartbeat. Moving on to our arms. Focus how they feel. Moving on to our hands. Focusing on our palms. And now I want you to touch every single one of your fingers with your thumb one time. And don't forget to breathe. Moving on to our legs. And now moving on to our feet. Now I want you to put your feet flat on the earth. Feel the earth beneath your feet. How does it feel to be grounded? Now focus on how you're feeling right now. And take one deep breath in. Hold your breath and breathe out. And now just enjoy the silence for a second. Okay, you can open your eyes now. And I hope you feel as relaxed as I did after the last speaker's little exercise. Exactly. So there are a few measures you can adopt. And I, for example, always did mindfulness exercises before my interpreting exams. And this can help depending on how severe your stress is. One other example for a conventional self-care measure is spending quality time with loved ones. So as I said, using these techniques can help to manage stress. But, of course, when you suffer a great amount of stress or when you suffer from a mental illness, breathing probably won't help you. So what I'm trying to say with this is, first of all, you have to assess how bad the situation is. Because in order to understand the magnitude of mental strain, in order to take the necessary steps, you have to understand the magnitude of your mental strain. And there are 3 ways, which you can see here. And you first have to become aware of being negatively impacted, because sometimes we go through life and we're incredibly stressed and we also feel symptoms of stress. For example, you fall ill or you have a headache or you can't sleep and you think, okay, it's just a bad week, right? But that's sometimes your body telling you, okay, slow down. You're incredibly stressed right now. Please do something, help me. Second of all, once you have realized that you are stressed, you have to actively decide to take self-care measures. I think you can compare that to a person who's doing a therapy who's not willing to open up to their therapist. For example, they're not telling the whole truth or they don't want to talk about a traumatic event. So you have to actively choose to receive help or help yourself. And then lastly, you can actually tackle the problem. So here we see a study by Questionnaire from 2014, and I'm mentioning the date because, as you can see, it really is now gaining momentum, because usually when you write a thesis or you just with literature in general, it's mostly from 1995, I don't know, but most articles I read were from this decade, which is very rare, so this shows us that this just wasn't on the table 20 years ago, and I'm glad it is now. So, as I said, you can see the research of Questionnaire here, and she distinguishes between the impairment of physical health, the impairment at the psychological level, the impairment of physical health as well as at the psychological level, and also burnout. Depending on what you are experiencing, you can adopt different measures, or you require different means of self-care. Here we can distinguish between the primary level of intervention, the secondary level of intervention, and the tertiary level of intervention. So let's take a closer look at the different levels. First, we have the impairment of physical health, and this is indicated through symptoms such as headaches, a tummy ache, fatigue, a sore throat, or poor sleep. So as I said, something you don't immediately recognize as mental strain, but is often caused by mental strain. So listen to your bodies. To combat the impairment of the physical health and said symptoms, you can adopt what we call psychosocial self-care. And I'm talking about interpreters here now, but for example, you can turn down assignments. So if you are feeling stressed and underwhelmed and someone offers you yet another interpreting gig, doesn't hurt to turn it down. I think it's hard, but sometimes it's the best thing you can do for yourself and for your interpreting as well. You should also take time to rest. And I know in today's hustle culture, it doesn't always come easy to us to rest and to do nothing, but most of the time you are more productive after having rested. You can spend some me time and time on recreation and hobbies. You can spend time with your friends, with your loved ones. You can spend time in nature. You can practice mindfulness with one of those mindfulness exercises. There are a few great mindfulness exercises on Spotify, by the way, so if you don't want me to do it every single time, there are plenty on Spotify, and they're very good. And you can also eat a healthy and balanced diet. I know everyone's saying that, but it's actually very beneficial, so don't neglect your diet. I know when you're stressed, you've got a lot on your plate, you don't necessarily feel like cooking a balanced meal or cook for 30 minutes, but it really does help. Something that also helps is exercise, especially outdoors. Moving on to the impairment at the psychological level. This is indicated through symptoms such as mood swings, poor judgment, poor memory, or poor concentration. To combat that, you can apply psychosocial self-care measures, which I just mentioned, and you can also pair them with medication. Here, of course, you have to see a doctor first, have the doctor assess you, which is in general always a good idea. Even if you have a few good measures at hand, it's always good to actually consult a professional and have them tell you what exactly the problem is and how you can combat it. When you suffer from both impairment of physical health as well as the impairment at the psychological level, you can use secondary level intervention. This means you adopt psychosocial means of self-care, you take your prescribed medication, and you see a doctor or a counselor on a regular basis. Let's say our interpreter or just any patient really suffers from burnout. Here, the literature suggests tertiary level of intervention. This means you use medication, you talk to a doctor or counselor, and also you submit yourself to hospital for a while. And with every one of those levels, containment is always indicated as well. So, moving on to post-setting counselling. As I said, self-care measures are nice. Doing a downward-facing dog is nice, lighting a candle is nice, mindfulness is nice. But if you suffer from severe mental illness, this won't do the trick. In order to really tackle a serious mental illness, you have to reach out for help and you have to talk to a professional. And that is exactly what is happening during post-setting counselling. It's called post-setting counselling, but to me it's more like a therapy session for interpreters. During those debriefings, you can of course talk about the interpreting assignment as well, because sometimes having had a bad interpreting day can also drag you down, so you feel inadequate, maybe you didn't know a specific word, and because of you the whole conversation stopped. So this can also be a big downer for you, so of course you can also talk about the interpreting assignment, but mostly it's meant to talk about your emotional state, you being the interpreter. You can talk about how the interaction made you feel. Were there different parts that made you very emotional? What made you emotional? How do you feel now? How would you want to approach this during the next encounter? Or how will this affect you after the debriefing session? Exactly. Whenever an interpreter feels distress or was confronted with aggression, for example, they should talk to the mental health care provider about it. They should really go into detail and they should have the therapist assess their situation. Because the perspective of the mental health care professional can really help the interpreter to understand the interaction in itself, but also to understand themselves and why they feel the way they feel, why certain things that have been said make them feel the way they feel. Exactly. As I said, this can also, on an interpreting note, can also help you to be a better interpreter in the future. Right. Let's say the deep breathing session is over, but you still feel stressed, you feel anxious, you can't shut the thoughts about the encounter out. You can always seek further assistance. And in most cases, the mental health care provider can also provide the therapist with assistance. If it's not them, maybe a colleague, refer them to someone, ask them exactly what do you need, what do you want to talk about, and then get them the help they need. Because of course it is overwhelming, it makes you feel a lot of emotions, and this is something you really have to tackle at the root in order to not let it spiral into something very, very big. So, it is scientifically proven that those deep breathings are vital for interpreters working in those settings. And in my opinion, and in the opinion of research, this should be viewed as a part of the assignment. So, mostly when we talk about interpreting, you have your gig, you get material to prep for your gig, then you're done, you write them a check, they pay you, bye-bye. But with mental health care encounters, it's a bit different because there are so many complex layers to it that you have to think outside of the box and you have to think about the interpreter's mental health as well. So those deep breathing sessions, even though your encounter is over and even though you've been paid, should be integrated in the process as well. With mental health care setting interpreting, there's another problem we have to face. Most of those interpreters are not trained interpreters because, as I said, you mostly use languages you don't really study here at school. For example, African languages or Asian minority languages. And I have never heard of a university offering that. I know that some universities offer, for example, Japanese or Chinese, so not just European languages, but mostly you don't really study Farsi, for example, and you are bilingual, that's why you work as an interpreter, but you never underwent any sort of training. So without that training, you are also more susceptible to mental stress because now we have two problems. We have the emotional stress, and I think everyone here will agree with me, you have cognitive stress because interpreting is exhausting. And pair those two things and you have a very exhausted interpreter after the encounter. Exactly, so that should be taken into consideration as well. You have someone who doesn't work as an interpreter full-time, they never underwent any sort of training, they don't really know how to prep for an assignment efficiently, and now you put them on the spot and tell them, okay, interpret for a 1.5 hour encounter, and afterwards, bye, you can go home. So you see, it's quite complex. Right. Another problem, this support system that therapists have, because as a therapist you have to undergo therapy as well. That's sort of part of the deal. You also learn about it during university. They prepare you for how you will feel, how therapy will make you feel. You have to do internships, so you really know what you're getting yourself into. But that's not the case with interpreters, because as I said, you don't have this sort of training. Let's say you don't receive adequate support. This could pose a lot of problems. For example, this whole over-identifying with the client, and all of this can then result in vicarious trauma. All right, moving on to my research, and just a little reminder, my aim, or the aim of my study, was to gain insight into mental strains, positive impacts, possible stresses, self-care strategies, and also post-setting counseling. What exactly did I do within the scope of my research? I also saw on Zoom that some of the team members from the research project I worked with are online as well, so hi. I'm very happy you're here. Nice surprise. I conducted interviews with 2 interpreters and 2 therapists of the Your Treat project of the University of Bielefeld. And Yasmin, I'm very sorry if I'm totally butchering what you guys are doing, but I will try to summarize your project a little bit. So they are conducting randomized controlled psychotherapy studies, and they look into the efficacy of exposure therapy for children, which is also called KidNet, as a treatment for traumatized minors. So they work with kids and adolescents that experience trauma. And Your Treat targets mostly refugee and asylum-seeking children between the age of 10 and 18. And the aim of the project is to investigate to what extent KidNet can help with symptoms of PTSD. And I was very impressed by that project. My best friend Verena, who's also present, hi, works as a research assistant, and she told me about this. And we, because she likes research as well, so we often brainstorm about, what could you do? That's so interesting. You could also look into this, and you could also do that. So there we were brainstorming again, and I was just looking for a topic for my thesis. I was kind of desperate. I didn't know what to do. And she said, oh, you could actually do that. And I was like, oh my God, that's so interesting. Let's do it. And so she gave me Yasmin's email address, and yeah, the rest is history. And exactly, as I said, they mostly work with refugee children and asylum-seeking children. And of course, they don't speak German or English or any of those languages, so you need interpreters. Right. I will tell you about my research questions again, because I'm pretty sure you have forgotten about them, and they are quite important for my questionnaire in order to understand my questionnaire, which you can see here, or one part of it. So I focused on 6 questions. The aspects that cause mental strain, then the negative impacts, the positive impacts, and how interpreters can combat possible mental strains, as well as the role of post-setting counseling, and then possible dangers of not adopting self-care measures. And I will just show you the second page as well. As you can see, my questionnaire was in German, and in hindsight, not my wisest choice, because I conducted the interviews in German as well and had to translate every single one of them into English to integrate them in my thesis. So if you ever conduct interviews, conduct them in the language you're actually speaking, writing your thesis in, because that was a lot of work. And what's important to mention as well, so I had 2 different questionnaires, one for the interpreters and one for the therapists. And I asked about the same things, but I just adapted them to whomever I was speaking to. And for example, I gave them a little list of symptoms, and I asked, let's say, the therapist, okay, has an interpreter ever told you about having experienced anxiety or having felt isolated from their surroundings? And with the therapists, I asked them, hey, have you ever experienced insomnia? Exactly. Cool. Sorry. I'm a bit nervous, so please bear with me. Right. In order to analyze my research, I distinguished between different categories, which were quite similar to my research questions. So I had 5 categories: reasons for mental strain, negative symptoms, positive impacts, possible means of self-care, and benefits of post-setting counseling, and dangers of lack of self-care. So, what did I find out? Let's talk about my results and the data analysis. First, we have reasons for mental strain. The main cause for mental strain in interpreting in mental health care settings with refugees is, as I said, sharing a cultural background with clients. And every single one of my interviewees said that, apart from me reading about it, and I was actually it was quite interesting to see that what you read in literature actually applied in real life. And I was like, oh my God, I didn't read all of those articles for nothing. That's so exciting. So they agreed with that this is definitely the reason why they felt stressed or emotional. And one of the interviews, for example, told me about this little refugee boy, and he was the same age as her son, and he sort of looked like her son, and then he started crying, telling her about this horrible thing that had happened to him, and she just cried with him because she was so emotional, and he reminded her of her son, and she thought about what it would be like if her son had to go through something like this. And so this connection to the client, or the boy, because, I mean, we talk about patients, but really they are little children, which makes this all the much worse. And this just made her really emotional, because she thought about her son the entire time and what it would be like if she, because her parents had fled the country, so it wasn't actually her who fled the country, but it could have been her and it could have been her son, which made her very emotional. Due to this shared, possibly traumatic experiences, interpreters are more easily triggered by the stories of the patients. And as I said, they often over-identify with their clients, and sometimes they revisit their own personal and sometimes unresolved grief. It makes them think about their past and their families and their friends, and this can evoke negative emotions in interpreters that had been buried in the past. And this can also lead to the interpreter mirroring the client's negative emotions. Right. It's also hard to set boundaries, because you feel very connected to the person, and they also, because they can't really relate to the therapist, because they don't share a cultural background with them, they share this background with you, so of course they want to bond with you and not the therapist. So they bond with you, you bond with them, maybe you even feel like, oh, this person could actually become a friend, but you have to set boundaries, which is really hard in that case. And as I said, interpreters, especially working in mental health care settings, are very altruistic people. So they want to help the clients outside of encounters. They want to, for example, accompany the children to school, because at school no one talks to them because no one speaks their language. So they struggle there, they struggle at the doctor's office, they struggle with red tape. So they feel this urge to help their client, but they can't, because that would be highly unprofessional. When realizing that you can't actually help the client outside of the counter, this can lead to the interpreters feeling an overwhelming feeling of helplessness and guilt. It can be concluded that the extent of agony interpreters are confronted with when interpreting for survivors of war or for refugees is straining in itself. This emotional strain is then furthermore exacerbated by the interpreting task being very, very exhausting, as I said, as we all know. And this mixture between cognitive and emotional strain can be incredibly exhausting, and this can deteriorate the mental health of the interpreters. So now we know why one might feel stressed when working in mental health care settings. Let's move on to what symptoms you might, oh my God, I'm way, okay. I will speed up, sorry. Okay, so you might experience sadness, low energy levels, emotional exhaustion. I'm sorry, I'm gonna speed up a bit. The interpreters are looking at me in shock. Right, there are a few things you can experience, such as lethargy, helplessness, a changed perception of reality, and so on. Interestingly enough, the question interpreters mentioned more negative impacts than the therapists, and I assume that this might be due to the interpreters not really mentioning every single one of those symptoms during therapy sessions, because sometimes, as I said, you feel like, okay, this is not relevant, I had bad night's sleep, but it's cool, I feel better tomorrow. So they don't really talk about that with their therapists. And I also saw that not a lot of negative symptoms were mentioned, and I think this was due to the disproportionately good support system offered by the Your Treat project. Because, as I said, you have briefings, you have debriefings, and you are in close contact with the therapist because you are assigned one patient, and then you sort of go on a journey with your therapist, with your patient, and then they are there for you and they offer you support along the way, which is not the case in all mental health care settings. Moving on to positive impacts. As I said, there are a few positive impacts you can experience, and they actually mentioned a lot of positive impacts, and it really warmed my heart to hear about them. And for a second, I thought about interpreting in mental health care settings as well, and then they talked about more bad impacts, and I was like, no. But they mentioned, for example, a heightened sense of optimism and empathy, as well as gratitude. They said it broadened their horizon. They said they felt good about themselves. They felt pride and purpose, and just all in all, it was very nice to hear about that. It really warmed my heart, and it's really nice to see how work can actually inspire you. Again, I heard about way more positive impacts than negative impacts, and again, I suspect this is due to the disproportionately good support system by the Your Treat project. Now, on to possible means of self-care. They mostly talked about psychosocial self-care measures, which I talked about as well. So listening to music, journaling, working out, spending time with your loved ones, maybe turn down an assignment or two, and so on. But one thing really stood out, and that was post-setting counselling. And I will talk about that now. What are the benefits of post-setting counselling? So I did talk about what exactly post-setting counselling is and what you do within those sessions, but why is it so beneficial? And one thing everyone talked to me about was putting your emotions and thoughts into perspective and have the therapist validate your feelings. So you feel overwhelmed and the therapist tells you, this is completely normal. I too feel overwhelmed when undergoing a really, really bad encounter. Your feelings are valid, don't worry about it, this too shall pass. And within the Your Treat project, they also do group counselling, and the interviews talk to me about feeling this sense of belonging and relief, and this also helped them to gain distance from those traumatic encounters. This is why I firmly believe that those debriefing sessions or therapy sessions should be remunerated or at least free. By the way, the Your Treat project pays the interpreters to take part in those counselling sessions, and I think that's the way to go because you can ensure that people will take part if you pay them. Moving on to possible dangers of lack of self-care. The bottom line here is if you don't look after yourself and you don't adopt self-care measures and you don't take part in those post-setting counselling sessions, your mental health will deteriorate for the same reasons. It might deteriorate because of the encounter, because you're not actively doing anything against it, and all of those negative emotions and those negative impacts will just crash down on you, and you will feel all of the symptoms I mentioned. All right, and now on to my conclusion and outlook, and then, okay, that's not too bad. We're just 10, that's fine, I've seen worse. Right, so my bottom line here is that I firmly believe that you should teach interpreting students and interpreters about mental health more. Because as I said, in order to tackle the problem of mental health, you first have to understand, how do I feel? Why do you feel like this? What could I do about it? And this should, that's not just the case for mental health care interpreters, that's the case at university, that's the case for conference interpreters, because that too can be very exhausting. So we should tell people about mental health more. As I said, I also think that those counselling sessions or that training should be facilitated, it should be for free or even remunerated. And lastly, as I said, this is only now gaining momentum, and I'm very excited to see what the future holds, because I feel like there's a lot to explore here. And one thing I wanted to say at the end, I know this was all a bit gloomy, and I probably didn't advertise interpreting in mental health care settings, but it can also be incredibly rewarding. I can tell you more about it later because I wanted to touch upon that, but we've run out of time. But it can be very rewarding, and if you're up for it, it's a very nice way to earn money because you are helping people, you are learning a lot about yourself, and I think you can really benefit from that. And on that note, I'm done, and sorry for speeding up at the end, and sorry for excessing my time limit. Thank you.